One of the biggest concerns I hear from patients considering facial rejuvenation is this. Dr. Yu, I want to look younger, but I don't want to look like I've had work done. And honestly, I completely understand that concern. Most patients aren't looking to become a different person. They're not trying to look dramatically younger or completely change their appearance. What they really want is to look refreshed, rested, and more like a version of themselves they remember from several years ago. Unfortunately, many people have seen examples of facelifts that look tight, stretched, unnatural, or simply don't resemble the person anymore. Those results create a lot of anxiety for people who are considering facial rejuvenation for themselves. The good news is that modern facelift surgery has evolved significantly over the years, and understanding why some facelifts look natural while others don't starts with understanding how the face actually ages. One of the biggest misconceptions about aging is that it's simply excess skin. While loose skin certainly contributes to an older appearance, that's only part of the story. As we age, the deeper structures of the face begin to change. The cheeks gradually descend, volume shifts downward, the jawline loses definition, and the neck often develops laxity. These changes occur beneath the skin and affect the overall architecture of the face. If aging occurs in the deeper tissues, it makes sense that the most natural rejuvenation often comes from addressing those deeper structures. When people think of an old-fashioned facelift, they often imagine skin being pulled tightly toward the ears. That type of result can sometimes create that stretch appearance that many patients want to avoid. Modern facelift techniques focus less on creating tension and more on restoring anatomy. The goal is not to make someone look different. The goal is to restore facial structures closer to where they were years earlier, while maintaining the patient's natural appearance and facial expressions. When that's done well, people often notice that the patient looks healthier, younger, or more rested without immediately identifying that surgery was performed. In fact, some of the best compliments my patients receive are things like, "You look great," "You look well rested," or "You look healthy." Notice that nobody is saying, "Did you have a facelift?" That's often a sign of a successful result. Another factor that influences whether a facelift looks natural is patient selection and treatment planning. Every face ages differently. Some patients primarily struggle with neck laxity, others are more concerned about jowls. Some patients have volume loss, while others have excellent volume but significant tissue descent. Because of these differences, there is no one-size-fits-all approach to facial rejuvenation. The best outcomes occur when the treatment plan is customized to the patient's specific anatomy, goals, and concerns. This is also why a thorough consultation is so important. Many patients come into the office believing they need one procedure, when in reality, a completely different approach may better accomplish their goals. Sometimes surgery is the right answer, sometimes it isn't. The key is understanding what is causing the concern in the first place. Ultimately, natural-looking facial rejuvenation is about balance. It's not about looking 20 years old again. It's not about creating a dramatic transformation. It's about helping patients look like the best version of themselves while preserving their unique characteristics that make them who they are. If you started noticing changes in your jawline, neck, or lower face, and you're wondering what options may be available, the first step is simply getting an expert evaluation and understanding what approaches might be most appropriate for your specific situation. The best facelift is often the one nobody notices. People simply think, "You look great," and that's exactly the goal. If you found this helpful, be sure to subscribe for more videos on facial plastic surgery, aesthetics, and patient education. Thanks for watching.